Okay, so hi everyone at Castro Valley. Thank you so much for coming today. I have here today our residents from John Muir Health who have just begun their, time with becoming a doctor. So I'd like to have them introduce to you themselves today. So, Dr. Aaron, if you can start.
Hi, I'm Erin. I'm a first year resident at John Muir, and I'm really happy to be here.
Thank you. All right, Dr. Scroggins.
Hi, I'm Kyle, or Dr. Scroggins, also a first year at John Muir.
Okay, Dr. Martinez.
Hi, I'm Dr. Martinez, also a first year.
Awesome. So we're going to start pretty quickly. Besides that, I just want to start off with everyone, thank you so much for being here. I appreciate all the work that you guys are doing, during COVID. You guys seem very busy and, we can't appreciate this enough for what you guys are doing today. So we're going to start off with a couple of questions about your experience, especially right now. To start off, I want to make sure you guys explain your education, your undergrad, what school you went to, your major, the medical school you attended, anything you think would be important to mention at this time. So Dr. Chen.
So I went to undergrad at UC Berkeley, and then I spent 1 year scribing for a company in San Francisco, and then I went to medical school at USC. Okay. And now I'm here. Yeah.
And what major did you have at undergrad?
Oh, I was a psychology major.
Oh, okay, that's awesome. Yeah. All right, Dr. Scroggins.
Yeah, I went to UC Davis. While I was there, I got a dual degree in neurophysiology and psychology. And then took a couple years off after undergrad because I completely burned myself out doing that. Tried to convince myself to do any other career but medicine, but couldn't. So applied to med school and went to OHSU up in Portland. And now here I am.
Okay, that's awesome. Dr. Martinez?
So I started at Chabot College. It's a community college in Hayward. I transferred to UC Berkeley. My major was molecular and cell biology. There's a few tracks within it. I chose the neurobiology track, and then went to med school at Stanford.
Oh, wow. So you guys have all been through different walks of life and different experiences to get to the same point. That's really interesting. Let me see. So our next question regarding, our undergraduate education, how important do you feel your university major was to get into the career field? Dr. Chen?
I honestly don't think it's that important as long as you do all the core subjects like biology, the ones, chemistry, physics. So yeah, I think you can major in basically anything, but as long as you do the prerequisite courses, then it's totally fine doing those just to get into medical school.
Okay, Dr. Kyle or Dr. Scroggins, anything to add?
Yeah, I largely agree. The average tends to be something that's biology based just because the prerequisites to get into medical school are often already a part of those majors. So it's not as much extra work. But there's a lot of people that will actually tell you that majoring in anything besides biology actually makes you look more interesting because so many of the people who do apply are biology majors. So any sort of diversity in terms of your educational background can actually help, maybe, although that's a totally unsubstantiated rumor as far as I know. But the sort of flip side of that coin being, if you're not a biology major, it does require a little extra work outside of your field of study during undergrad to make sure you have all the classes you need.
Okay, yeah, I know there's a lot of classes specifically with biology and chemistry that you have to prepare for, even writing, I believe, correct? A lot of reading and writing you have to prepare too. Yeah, so that's a lot. Dr. Martinez, do you have anything to add?
So same thing they already said. I was a biology major or neurobiology, but I just chose something that interested me. And I think that's the most important thing. Choose something that you're gonna like, that you'll enjoy. If it's in the science field, great. If it's not, then just take a few classes to meet the prereqs. But
Okay, that's good. Yeah. It's good to know that there's different ways of, approaching this field and not having to pressure going to just one track, because that, kind of gets a little tiring, but that's awesome. You guys have all different experiences. Our next question would be, how did you become interested in this career? Like, what inspired you to become a doctor? Dr. Chen?
So I don't think any one thing inspired me. It was mostly the collection of life experiences. And then it really just boiled down to, I like biology. I'm fascinated by human psychology and biology, physiology, and I want to help people, and that's what I want to spend my life doing. So it basically, medicine was the perfect fit, basically.
Oh, that's awesome. Dr. Scroggins?
For me, I decided I wanted to be a doctor when I was about 8 years old. I had brain cancer as a child, and so I spent roughly 6 years in and out of the hospital fighting that. And after spending as much time around doctors, I realized that I just find it really cool. And then, as I grew up through life and went through like undergrad and college, nothing else really grabbed my interest in the same way. And it's sort of like it's sort of the meeting point between the more hardcore sciences as well as the more, social aspect of science. So if you're someone who actually enjoys getting to know new people and talking to people all day, every day, it's a field that really lends itself to that.
Oh, wow. That's a good inspiration. I'm really glad you were able to overcome that. I commend you for, wanting to get into this after going through all that. Wow. Thank you. Dr. Martinez, do you want anything to add?
I'm more along the lines with Aaron. I love biology, science, all those courses always intrigued me. I was good at them, and I think no matter what doctor you ask, they'll all say something along the lines of, I want to help people. And that should be a big reason you're getting into it. And so, yeah, the combination of those kind of just melded into a medical career for me.
That's awesome. Excuse me. Oh, that's great. I think it's so important to have type of passion before you enter this field, just because there's been a lot of mishaps where some people just kind of go into it blindly without knowing what to do about it. So, knowing how you guys get into it, why you get into it, definitely drives you to become a better person in this field. So thank you for providing that. Our next question is regarding medical school admissions. Do you guys have any tips for the Mcat, which is the medical college admission test? Is there any important coursework? You guys mentioned a lot of biology classes, chemistry. Is there anything you guys would know to be important to add for students to know before getting into medical school, regarding admissions? Dr. Chen?
So for the Mcat, I think my one advice for that would be not to start studying too early. Maybe 3 months at most before the Mcat, and don't stress out too much about it, because looking back at my experience with the Mcat, I remember just being incredibly stressed out and essentially crying every day, and it was not good. And honestly, the Mcat is not something you need to stress out too much about.
Oh, well, that's good to know. Yeah, that people get a lot of pressure, wanting to get the best score, which schools are going to be accepted. So that makes a lot of sense. Thank you for that. Dr. Scroggins?
Yeah, so I took the Mcat a couple of years after graduating college. And so since I was a little ways away from when I had been studying, I took a prep course, which seemed like maybe it was helpful. They're crazy, crazy expensive. And I don't know that the course itself gave me more than just the prep books would have. So if I were doing it again, I don't know that I'd pay the money, but at the time it felt like I didn't have a choice, because I was so separated from when I had been learning things initially. But you'd be, if you're in a similar situation, you'll be surprised by how quickly things come back. So I'd say maybe give it a shot without shelling out the money first if you're kind of on the fence. But I do think the prep books, and there are a million to choose from, but those definitely were very helpful, if for nothing else, but because the way questions are asked on the Mcat is pretty different, at least in my experience, from any other test I had ever taken. And so getting familiar with how they ask questions is probably important before you try taking the exam, or it might be kind of a shock regardless of how well you know the material. And then otherwise, in terms of just sort of med school admission as a whole, I think a lot of people going in don't know that it's not uncommon for people to apply more than once. There are a lot of doctors who didn't get into medical school their first time around and had to apply again. And that doesn't make them any less of a doctor after they have their MD. So knowing that that's a possibility, and that if you try again, you can always try again, and that if it's really what you want, then I would highly encourage you to do so.
Oh, well, thank you. Yeah, that I think it alleviates a lot of the pressure and the fear of like not getting into it, first time around. That's awesome. Thank you. Dr. Martinez, anything to add?
I would say, so I really enjoyed all the chemistry, physics classes. So I learned the material well, not just because it was a prereq, but because I enjoyed it. So when it came time to studying for the Mcat, like Kyle said, a lot of it just came back. So learn as much as you can from your prereq courses. The section that that had trouble with the most, and now the Mcat has changed since I took it, but there's still some of this in it, is the verbal section of it, where it's like reading, and you read some like philosophy like passages, and it's like, for someone with a science mindset, you're like, what is this? Like, I don't care about this. So I would say I focused a lot of my time on that when I was studying for the Mcat. And then in admissions in general, extracurriculars are pretty important too. Just find things that, again, like going back to the major thing, find things that you like to do that bring you joy, because when it comes time to submitting your application, it'll show that you did something you enjoyed. If you can get some clinical experience, that'd be great, because it just shows that one, you actually enjoy this, two, you know what you're getting into. And so, yeah, if you could find some clinical experience as an extracurricular, that'd be good. It's not the end of the world if you don't. But yeah, just find something you enjoy and let it shine in your application. And start looking for good mentors that could write you a letter of application, letter of recommendation, because those make a difference too.
Okay, and then with the letters of rec, it could be like a mentor, it could be like a professor that you had, like an undergrad type of thing. Would that be places or people you'd recommend to reach out to?
Every school has requirements on where the letters of rec need to come from. Like some are like 2 must be science professors, 1 can be anywhere else. So I would say know what schools you for sure are going to apply to, see what their what their requirements are. But in general, I think most schools require at least 2 letters, and at least 1 has to be from a science professor.
Oh, okay, that's awesome. So like from what I'm hearing from you guys, I feel like it sounds like, it's extracurriculars and like everything we've discussed, like with the preparation for that. I mean, it just sounds like you want to not only focus on like the medical side of things, but also like making sure you guys are focusing on like things that you still like to do. Because I've heard a lot of things where a lot of people kind of cram all the essential like clinical stuff and all those experiences just specifically to medical school. and they kind of forget about, having fun and enjoying themselves. So I think that's super important to point out to kids and students, like, figuring out like, oh, it's not only about getting to the destination, but enjoying the time and the journey. So that's awesome. So yeah, our next question is, what do your day-to-day responsibilities look like? I understand you guys are super busy. You guys have a ton of stuff. So, I mean, once you guys start, what do you do? Dr. Chen?
So as a resident, our days are very different depending on the rotations that we're on. So for example, on my current rotation, which is vulnerable populations health, I basically spend, in the morning, it's like 8 to 12. I'm doing some learning about like social determinants of health. I'm at the Monument Crisis Center, tabling and answering patients' questions about, or the people's questions about their health. I'm shadowing chaplains. It's learning medical Spanish. It's a lot of different experiences. And then in the afternoon, I'm usually in clinic seeing my patients.
Okay, I think that's important to note when you work at a nonprofit or you're able to volunteer there. It's like, one thing, you're not able to like diagnose patients, you're just giving like some type of medical advice and referring them to other individuals because you're not able to diagnose, right?
Yeah.
Okay, awesome. Dr. Scroggins, what would you say would your be day to day? I see you're very busy.
Yeah, so I mean, like Erin said, every day is different depending on the rotation you're on. Currently, I'm on labor and delivery, so we're essentially, I'm helping to deliver babies. So throughout this rotation, you're usually on at 7 a.m. And off at 7 p.m. During that time, you're being, birth is unpredictable. So you're checking on your patients, seeing how far into the process they are. Once they are ready to give birth, you're there helping them to deliver the baby and just making sure that everything goes smoothly along the way. And then on this rotation, we do 24-hour call periodically. So after that 7 a.m. to 7 p.m. shift, overnight, a couple nights a week, you keep your phone very close to you. And if any patients do come in, you go back to the hospital, admit them, check on how they're doing, see what they need. And then if everything is more or less quiet, then you can go home and go back to sleep. If things aren't as quiet, then you stay in the hospital and try to nap when you can in between helping to take care of them.
Oh, wow. Yeah, that sounds like a lot of work. I can only imagine. I don't have children yet, so that's going to be something to look forward to, I guess.
Yeah, the babies come when they come and you can't predict it. So you make yourself available.
Oh, that's awesome. Dr. Martinez?
So yeah, your day depends a lot on whether you're on outpatient or inpatient rotations. Outpatient being like clinics and things like what Erin is doing in the mornings. And then Kyle is on inpatient, that's labor and delivery, or pediatrics inpatient, like hospitalized kids, or adult inpatient, hospitalized adults. Your inpatient rotations are more hour heavy. You're there 6 days a week, usually 7 a.m. to 7 p.m. If you're a little slower like me, then you try to get there around 5:30 a.m. to make sure you have time to see all your patients and know what you're going to do before the head honcho comes and you have to tell him what the plan is. Other than that, it's really going to also depend on what specialty you're in residency for. We're in family medicine, meaning we have to know a little bit about everything. So we rotate through a lot of what might seem random things. We're delivering babies, we're seeing children, we're seeing adults. If you're in a surgical residency, then you'll be doing mostly just surgical inpatient things in different surgery specialties. If you're in internal medicine, you'll mostly be seeing adult patients in the hospital during residency.
Okay. And then you guys are usually being supervised by a attending physician, correct?
Yeah.
Okay, cool. Just had to be sure. So
Yeah,
that
yeah.
sounds.
As residents, we only have essentially a partial training license. So everything we do has to be signed off by someone who's watching over us, essentially, because we are still learning. And so there's that safety net where they're helping us if we ever do have, or when we ever do have questions, and making sure that anything we do is going to make sense.
Okay, yeah, that's interesting. You guys all doing separate things and new things, and I think it's different or good to talk about, the different residency programs or specialties that you guys are focusing on. So the specialties that you guys are mostly with family medicine. So this residency with John Muir is with family medicine then, correct? Okay, awesome. All right, well, that's awesome. Thank you guys for sharing that. Another one, the question that they had, the students would say probably is a hard one, would be, what would you guys dislike or like about your job? Dr. Chad.
So I'll start with what I like first. I really like the variety that I see day to day. All my clinic patients are all coming in with different things. One's coming in for like prenatal visits, others are coming in because they have back pain or they have some skin issue, and it's just all different. And I love interacting with my patients and I love being able to help them out. What I don't necessarily like is just the amount of paperwork that goes with it. With every single patient, you have to write a note, you have to make sure that you're billing correctly, you have to like click all these little boxes just to make sure that everything is, kosher. And it can get a little tedious. But other than that, yeah, it is what it is.
But you would say the good outweighs the bad, correct?
Yes.
That's awesome.
By far.
Dr. Scroggins?
Yeah, I mean, I agree with everything Erin said. In addition, I think the parts I love the most is that it's a field that does challenge you intellectually on a daily basis. There's so much to learn, and you can be going through your entire career still learning something new every single day. So if that's something that excites you, then medicine's a great field for you. If that sounds unbearable, then medicine might be hard, because the field is constantly changing. We're constantly doing new research. There's new medicines available. So even if you were at one point to learn everything there is to know, by a couple months later, there'd be something new. So it's constantly shifting and evolving and challenging you in new and different ways all the time. Sort of the flip side of that being then that what makes it particularly challenging is you do have to, even on your own time, put in time to the job. So it's a very time-consuming job. The hours are long, like Hector was saying, when you're on an inpatient rotation, 12-hour days, 6 days a week is kind of the norm. And then some in other specialties do even longer days. So it's something that you have to be very sure you enjoy, because otherwise that kind of time commitment becomes really hard to keep up with over time.
Oh, okay. Wow. Go ahead.
I will say that while the time commitment is very, very long now, and it will be for a while, as you get farther along in your career, you're able to dictate your hours more and maybe take a little more time off, or put in a little more time there. And you can dictate your hours more as you advance further along in your career.
Oh, that's good. That's good to know. Yeah. Dr. Martinez?
Yeah, it won't be 6 days a week, 12 hours forever. I'll eventually get to a point where I'm 8 to 5, maybe 4 days a week. Yeah, definitely what I love the most is the patient interactions. I mean, that's what most of us came in it for, is to help people. And when you're able to help someone make their lives even slightly easier or better, that's the most rewarding thing. And it makes those hours worth it. Um, the things I don't like about it, definitely what Aaron said, the paperwork that goes into it. And like dealing with insurance companies, like someone comes in with shoulder pain and you want to get them an MRI, you have to have like a specific diagnosis to it. Like it can't, you can diagnose the right thing, but if it won't cover it, and like there's all these, you have to learn all these like coding things so that you can get their things covered. And then as first years, we have a lot of time with our patients right now because they don't stack them up so much. But in the future, it might get to a point where I have like 15 or 20 minutes to see a patient. And that's one of the things that I'm not looking forward to, because it's just going to be such a rushed interaction. I enjoy talking to my patients and hearing their stories. And it's something that's not, 15, 20 minutes won't really allow for much of that. On the flip side, I'll know them a little more by then. So, 15 or 20 minutes could be a valuable time with someone that I already know. But yeah, I wish I would be able to have longer times to see patients.
Oh, wow. Yeah, I think that's something to discuss with like, the changes in the system of like providing, enough time for you guys to talk about, enough like questions that, people might have for you guys, so I think that's super important. And I think also like piggybacking on all the things you guys have mentioned, like, the support system that you guys are being provided, as physicians, or the medical assistants, the nurses, everyone that's around you. You guys are mentioning a lot about billing and coding. And I know there's like a lot of classes to take to just become specifically for that. So I can only imagine if they have to memorize like a big book of like specific codes that change all the time. So yeah, that's definitely hard. And I'm glad you guys are able to kind of understand how important the hierarchy is within you guys too. Respecting everyone else and making sure you guys are providing the most support for the patient. So I think that's awesome that you guys pointed out all those things. Yeah, so that's great. Thank you guys so much for that. Our next question would be probably about like time management. I know a lot of students, it's a lot with you guys what are doing, so I would recommend like, what would you guys think about like what time management tips, like what did you think that has like helped you balance your work life, your home life and all that while being a resident? Does that even exist, Dr. Chen?
So my biggest advice for time management is to prepare beforehand. So for example, if you're like seeing a patient and you only have 20 minutes, like look at their chart beforehand and prepare, like what are they coming in for? What questions do you need to ask? Prepare the note beforehand, just so you can like fill in just a little bit of a few things during the visit, and then that's it. Your visit is over. And then along with that, just being prepared is make sure that you spend time for yourself, because if you don't practice self-care, then you're just going to get burnt out and everything you do is just going to be sluggish and lagging behind, and you're not going to be at your 100%. So take some time for yourself, do the hobbies that you like, spend time with the people you love. Yeah.
Oh, thank you. Yeah, it's important to kind of focus on yourself, especially with how you guys are handling all these things, especially during the pandemic. This is definitely one of the important things to focus on at this time. Dr. Scroggins, what would you like to add?
I'd say that I guess toward the end of college, and especially during medical school, time management was not my strong point. So it was a pretty painful learning curve to figure it out while in med school. So I think I was the kind of student who would, cram the night before a test, and then otherwise try to enjoy life maybe a little too much the rest of the time, where I could have been using that time better. So I think really figuring out as early as you can that doing a little bit of work every day is way, way easier than doing a whole lot of work in one night. And I mean, there's even science showing that you'll remember it longer, your stress will be lower. So it's something that I wish I had learned earlier. And if I could go back again, I would definitely try to teach myself. It's just put in an hour a day, even if you feel like there's nothing you need to be doing. There's probably something you should be doing, because at any time we all have something we should be doing. And by doing that, you will end up saving yourself a whole lot of time and a whole lot of stress in the long run. Yeah, I think that's my biggest thing on time management. I'm still not great at it. It's something I feel like you learn all through life.
Oh, well, that's good. I mean, it's good to start, maybe like undergrad or like, even in high school. I think it's really good to kind of build those necessary things, that are going to be able to help you, with your life and future. So that's awesome. Dr. Martinez, anything to add?
I think for like undergrad and med school, having like weekly planners, like, and scheduling like what you're going to study is very helpful. I never did it myself. I'm a professional procrastinator, so I'm not even going to try to preach to people how they should study. I'm the worst. But in terms of like personal time management and like lifestyle, during residency, it's tough for sure. When you're on those inpatient 6 days a week rotations, my day off, I'm just trying to sleep, and maybe I'll wake up to eat something, but I'm just like trying to decompress. And then on your outpatient rotations where you have the weekend, you have a little more time to do things for yourself. I would say plan ahead, because you're not going to get anything done if you just wake up the weekend and you're like, oh, what should I do? So you can make the most out of your time if knowing ahead, you know what you want to do. And yeah, just enjoy that time so you can decompress.
And what would you guys say would be like a self-care strategy? I mean, like you guys you guys definitely mentioned sleep is one of the best ways for self-care. Do you guys do like any like extracurriculars or anything to like, decompress?
I really like baking. And I recently got a puppy, so I'm spending a lot of time with her.
Aw. Is there any other ones?
I took up indoor plants because it's a very low maintenance hobby. You can spend as much time learning about plants as you want, and then the other, 80% of the time, they're just kind of doing their own thing. As long as you remember to water them periodically, they're pretty much pretty low maintenance in that regard. And then I also got a dog, which has been great for both companionship, and it forces me to, take them out for walks and things like that. So I get at least a little bit of exercise.
Yeah, that's good things to mention. Dr. Martinez, anything?
I like to eat and watch Netflix or Hulu. Erin likes to bake, so maybe she could send some of those my way.
Sure.
Well, that's good. I think focusing, like you guys said, like with your hobbies and stuff, that's definitely self-care. Thank you for sharing all that beneficial things about time management. The next question is like, regarding like job approach and like search and all those things, like how did you guys find this specific residency program? What made it stand out from others? Was there specific things that you guys were looking for residency? Like, did you shadow a doctor? I think some of you guys mentioned scribing, and I know normally you shadow technically kind of following a doctor. And so if you can discuss, Dr. Chen.
So I did scribing to kind of amp up my application for medical school. For residency specifically, I knew I wanted to be in California. I knew I wanted to be in the Bay Area because my boyfriend's here. And so I just basically looked at all of the residency programs in the Bay Area. And this one caught my eye because they're more outpatient focused. They have a clinic first model. Yeah.
Okay. Dr. Scroggins, anything?
Yeah, I think in terms of specifically when it comes to residency, it does count as a job, but in sort of it's more similar to like a couple years of college than like a true job. So because we're still, training, we don't have a full medical license to practice by ourselves yet. It's a little different in that regard. I think the majority of people choose a spot like geographically as sort of their biggest filter. And then within, there's different things that different people are looking for. For me, the most important was finding a place where I felt, supported by the people around me. And you go through a whole interview process at all of the different programs you apply to. So you get a sense of what the sort of culture is within a program. And at John Muir, the culture was just well aligned with what my personal priorities were. So it felt like a good fit. But it's something that's highly personal to every person. So it changes drastically from one person to another.
Okay, that's interesting. Dr. Martinez?
So for me, I know that I wanted to do primary care and mostly clinical work. So the fact that John Muir focuses on that was important to me. There's some programs that they do like a lot of hospital rotations, a lot of ICU rotations. I know I'm never going to be working in an ICU, so that wasn't so important to me. So those were lower on my list. The area was big too. Most of my family's in the Bay Area. So my top programs were the programs here in the Bay. And then also just how you like connect with the people in the program is very important, because you're going to be spending 3 years with these people like very intimately, and so kind of just see how the people there are interacting. Does it seem like they get along, like they have fun? There's times that Kyle and I are together like 80 to 100 hours a week, because we're partnered up in a lot of the rotations. So like if I didn't like this guy, like that'd be a tough 100 weeks. So 100 hours for that week. So yeah, see what the people are like. And oh yeah, and then John Muir is also very focused on like community outreach, and things like that, which was like super big for me too.
Oh, wow. That's awesome. Yeah, it's really good. It's really hard, I think, to choose a lot of residency programs because there's just so many options. I know there's like the surgical field, and there's like other more statistics and learning about like not statistics, I'm sorry, like research-based, fields where it's like everything's changing constantly. So I think it's good to kind of focus on what specifics you want to look for a program. That's one of the top things. That's awesome. So I actually think we're out of time. So besides that, I really appreciate, I know the students appreciate, Castro Valley appreciates it, to dedicate this time to kind of explore their options. So I can't thank you all enough for taking this time to talk about your experiences and all those things. So I thank you so much. Besides that, is there anything else you guys want to leave with for students? And if not, that's totally fine. Anyone, go ahead.
I was just medicine's super hard. There's no really sugarcoating that. It's no matter what field of medicine, either as an MA, an RN, a PA, or an MD, DO, the job is challenging. So it's something you just got to know going into it. But I also can't imagine a more rewarding field where literally everything you do every single day has a direct impact on people's lives, and hopefully for the better. So you really are spending your day trying to make people feel better and make their lives a little easier, and that's really awesome. It makes all the hard work worth it.
Oh, thank you. Dr. Chen, anything you want to add? Any last thoughts?
Just piggybacking off of what Dr. Scroggins said, you have to love what you do. Don't go into medicine. Don't become a doctor for the money, because there are people who do that. Go into it because you want to help people. You want to feel those little moments of gratitude every single day of just being able to be there for people. Yeah.
Oh, thank you. Dr. Martinez, any lasting thoughts?
Same thing. If you don't enjoy it, the money, the glory of being like, those things aren't going to make it worth it. There's like a lot of shows out there that like glorify being a doctor. Like, yeah, it's cool, but like you really have to have this passion for helping others, and that's the only thing that's going to prevent you from burning out. And otherwise, just enjoy the path there. Don't just do things to fill out boxes to get into med school. Do what you love, and yeah, have a good time.
That's awesome. Thank you guys for all the things you guys are doing. I'm going to end the recording real fast. Thanks again, okay?